Welcome back to the Aging Parent Playbook. I'm Dr. Barbara Sparacino, and today we're talking about one of the most important and honestly most stressful parts of caregiving, handling a medical emergency with your aging parent. If you've been a caregiver for more than 5 minutes, you know the reality. Emergencies don't give you a heads up. You might be cooking dinner when mom calls to tell you she fell. You might get that 2 a.m. phone call from the assisted living nurse saying dad's on his way to the ER. And in those moments, your brain can feel like it's short-circuiting. What do you do first? Do you have the right documents? How do you stay calm enough to make smart decisions? That's exactly what we're covering today. You'll walk away knowing how to respond in the first moments of a medical crisis, the must-have documents that make emergencies smoother, how to create an emergency plan that reduces panic and confusion, because I want you to walk you through not just what to do, but how to prepare in advance so you're not scrambling in the middle of chaos. So in this first segment, we're going to talk about what to do in a medical crisis. When a medical emergency happens, you don't have the luxury of time. You have to act. But the irony is, acting without thinking can also make things worse. That's why preparation is half the battle. Let's walk through what happens step by step. So step 1, assess and call 911 when needed. If your parent has chest pain or difficulty breathing, sudden confusion, drooping on one side, or stroke symptoms, if there's a serious fall or head injury, severe bleeding or loss of consciousness, call 911 immediately. Do not wait and see. Seconds can matter in these situations. I once had a client whose father showed mild stroke symptoms, but they thought he was just tired. By the time they got him to the ER hours later, treatment options were limited. Time is brain tissue when it comes to stroke. Step 2, stay calm and reassure them, even if you're panicking inside. Speak slowly and steadily. If they see your fear, their anxiety spikes, and that can worsen symptoms like shortness of breath or chest pain. Sometimes I'll even say, we're going to get through this together, while making eye contact. Step 3, grab the go bag. This is a non-negotiable. Your go bag should include insurance card and photo ID, an updated list of medications, dosages, and allergies, a change of clothes, essential medical devices, glasses, dentures, hearing aids, any mobility aids if they're portable. Keep it by the front door or somewhere obvious, and replace any outdated paperwork every 3 to 6 months. Segment 2, the critical documents you need. One of the biggest mistakes I see, families scrambling to make decisions without the legal authority to do so. That's when treatment gets delayed, or worse, decisions are made by strangers in a courtroom. Here's what you absolutely need before an emergency. Number 1, an advance directive. This outlines your parents' medical wishes. For example, do they want aggressive interventions or do they want comfort care? This removes the burden of guessing. 2, a durable power of attorney or a POA. This allows a designated person to make medical and financial decisions if your parent can't. Without this, even paying a hospital bill can get complicated. 3, an emergency contact list. Include all doctors, specialists, preferred hospitals, and close family members. Have both physical and digital copies of this. 4, a list of medical conditions. Don't assume every ER visit will have their full medical record available. A short summary can help the care team move faster. I recommend storing copies in 3 places: the go bag, your car glove compartment, and a secure shared folder like Google Drive so other family members can access them if needed. In segment 3, we're going to talk about creating your emergency plan. So emergencies will always be unpredictable, but you can create a plan that makes your response automatic. So here's how to start. First, choose a decision maker. Identify who will speak to doctors, sign forms, and make the tough calls. 2, map your hospitals. Know where the closest ERs are and which ones specialize in stroke or cardiac care. 3, assign roles. Who rides in the ambulance? Who stays back to grab the bag? Who calls other family? 4, practice. Run through the steps like a fire drill. It might feel silly, but it can save minutes in a real crisis. And remember, if you're the main caregiver, you also need a backup person. Illness, travel, or burnout can take you out of commission. Emergencies are stressful by nature, but with preparation, you can turn panic into action. Your homework: create or update your go bag this week. Check that all critical documents are signed and easy to access. Talk to your parent and your family about your emergency plan. I've put together a free emergency preparedness checklist you can download at theagingparentcoach.com. It walks you through everything we discussed today so you can start preparing immediately. Until next time, remember, being prepared is one of the greatest gifts you can give both yourself and your parent. So take care.